But eventually, it leads to poor posture, headaches, chronic neck and back tension. So, when we treat these tethered oral tissues, we're not just treating oral dysfunction, we are treating body dysfunction. And this is also why we need to work on interdisciplinary teams, because it's not just about the neck. And when I started this, my treatment approach did not look like this. It looked very linear, it looked very procedural. I see a tether, I release a tether, and now things are supposed to function. That is not predictable, and it is not how the body works. You really have to spend the time training them well, because they are representing you. And so if they are not trained well, then they are, you may not even end up seeing that patient if your phone person does not sound like they know what they're talking about.
Good evening and welcome, everyone. I am Lauren Gates. I'm your host of our Airway Health Solutions Conversation Series this evening, featuring Dr. Piya Gandhi. Welcome, Dr. Gandhi. How are you this evening?
Great. Thanks for having me.
Yeah, no, I'm so excited, and welcome on our faculty. We're so excited to have you for our faculty lineup, our new courses for 2026. So we'll get to that as well. But we really, you and I, we had a discussion and we wanted to talk about what should we talk about, right? And there is so much confusion with tongue-tied releases and how do you incorporate into your practice that we are making a 2-day course on it. But this evening, I really wanted to do a little bit of a different angle, as we discussed, and talk more about the practice growth opportunities through pediatric airway and tongue-tie care. So that's our topic this evening. And for those of you who wanted a little bit more information about, why you should do it and the health benefits of it, we did have another webinar that is recorded, and we'll put it in the chat for you to access that full hour. But Dr. Gandhi, we're thrilled to have you here tonight. You will do a little bit of an overview on why we should do it, but I'm really excited about the opportunities that dental offices have in particular to have this as a growth opportunity as well. So welcome, everyone. We're always thrilled to have you. I know it's a busy holiday season and there are parties and shopping and whatnot, so we really appreciate your time to joining us this evening. We know it's going to be informative, and there'll be key takeaways for you to implement into your practice. But we have over 300 registered this evening. So again, we're so grateful to all of our audience members for really taking the time and wanting to do better and learn more every day. So thank you all. It's a real testament to the airway health movement. I always love to get to know our audience a little bit better. So why don't we go ahead and see who's joining us tonight? We'll take a poll, and I'll let it up a little bit longer. I think I've been cutting it off a little bit too short in the past. So take a moment, and we want to get to know you. Please choose the best description that describes your job and your position. And if it's not listed, because we only had certain amount of slots to fill, you can just put it in the Q&A section, because we love to know where you are, what you're doing. You can actually put in the Q&A also where you're from. It's always nice to know. So we have the majority right now are dentists. We have pediatric dentists, an orthodontist, OMTs, SLPs, hygienists. We have a dental assistant, chiropractor, and other healthcare professionals. So let's look at that in the Q&As, who we have this evening. And we're thrilled to welcome everybody. We're going to go ahead and share the results here. Okay. So thank you for all you do. We're thrilled to have you here. Just a couple of housekeeping items that we are excited to have a raffle with special giveaway tonight. We're going to actually spin the wheel and raffle off our Pediatric Airway Health Fundamentals course with Dr. Ben Moralia. So you must stay at the end to receive that. So you got to be in it to win it. And to receive your CE certificate, you must be in attendance for the entire program. There is no code that we give you, just Zoom software tracks attendance, so we do not need to give you a formal code or track it that way. It'll be automatically tracked by your attendance. And then just a couple more disclaimers is that the views and opinions are presented of our speaker and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. And the following webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. The information provided should not be used for diagnosing or treating a health problem or disease, and those seeking personal medical advice should consult with a licensed physician or dentist. Always seek the advice of your doctor or other qualified health provider regarding a medical or dental condition. Okay, so that gets the kind of the housekeeping items out of the way. But Dr. Gandhi, before I do read your formal bio, let's just hear from you about the practice growth aspect. I know that you love what you do in the health aspect, but maybe just an overview of why you and I discussed from your viewpoint why we wanted to talk about this evening.
Yeah, so I think a lot of dentists go to CE courses and learn about something like great clinically that that sounds exciting that they could bring to their patients. And I think a big missing piece is in some of these courses is the practicality of it. So great, there's this clinical idea that sounds exciting that could help my patients. But at the end of the day, we're all running a business. And so it really has to make sense from a business aspect for us to really implement it and take this deep dive and essentially for myself change my entire practice. And I would say like I'm still a pediatric full-blown practice that does cleanings and fillings and checkups and all that stuff. But this type of care on the tongue tie, which is where I started, and now full-blown airway, in my personal practice, and we are 3 practitioners, it is probably 75% of what I do. And from a total practice, brings in, over 50% of our revenue. So this is a huge financial growth advantage that we have. But the reason it has grown so well is because of the health benefit that it provides.
Right.
And so it is not just benefiting my patients from a health perspective. It is also an opportunity for myself as a business owner and a practitioner to grow in a way that honestly none of my competitors are doing in the pediatric space. So that doesn't come without work. It doesn't come without education. It doesn't come without the mental and emotional sort of capacity needed to do these things. But there is a huge business growth upside when you start incorporating this stuff into your practice. So we're going to touch on some of that today. But really take a much deeper dive in the 2-day live mini residency that we're doing in the new year.
Right, and we'll be talking about that. We're super excited for that course. That's going to be in January 9th and 23rd to be live virtual and then be available on demand as well. So we'll discuss that after the course, but don't after this conversation, but don't worry, you'll learn all the tools, how to do that with the course coming up in January. So I'm going to go ahead and while you get kind of settled in, we're going to just give you the formal bio and then have you take it away and we'll have plenty of time for Q&A. So Dr. Piya Gandhi is a board-certified pediatric dentist and airway and tongue-tie specialist with a practice deeply inspired by her role as a mother to her daughters, Sira and Ayana. Since 2009, she has focused on the essential connection between breathing, airway function, and healthy pediatric development. Her practice offers comprehensive care from routine checkups to advanced screenings for airway disorders, functional issues, and tethered oral tissues. Dr. Gandhi has pursued extensive training in airway development and routinely evaluates children for concerns that may affect growth, behavior, and sleep. She believes in collaborative integrative care and works closely with an in-house team of specialists, including a speech-language pathologist, myofunctional therapist, pediatric chiropractor, and IBCLC, a dedicated educator, and she also lectures nationally to raise awareness of pediatric airway health and tongue-tie management. And we're now thrilled to have you on faculty at Airway Health Solutions. So let's take it away. We're excited to learn from you once again. Thanks, Dr. Gandhi, for joining us.
Yeah, thank you so much. And thank you for everyone again attending. December is a crazy month. So it really shows your dedication to the practice of airway dentistry and, tongue tie care. So today, like Lauren had mentioned, we are really focusing on practice growth. But I am going to touch on, just why we should incorporate these types of practices into our dental, whether that be pediatric or just general. Um, well, let's see if this will wake up for me. There we go. So Lauren mentioned a bunch of this, but just who I am. And I will tell you who I am today was not who I started out as a dentist. None of this was anything I could have imagined when I started in dentistry. And honestly, every day it keeps growing and changing. So every course I attend, every patient I interact with, every interaction I have as a mother continues to push me in the direction of understanding the connection of airway health, dentistry, and really overall health. So currently, I have two practices in Houston, Texas, Tanglewood and Westview Pediatric Dentistry. I now practice what's called functional pediatric dentistry, which is evolving and changing every day, but it is really understanding the connection of overall growth and development of the craniofacial complex with airway health, breathing, sleep, and our overall body health. I am the creator of the Function First model, which we're going to talk about some this evening, but take a much deeper dive into in the new year with the new course. I have received an award in laser surgery. I am a board member of the Airway Revolution Foundation, which is really focusing on bringing airway education to everybody, the people, not through our educational bodies, but really directly to the consumer and to the patient. And then, as Lauren mentioned, I am a faculty member now of the Airway Health Solutions team, which I am very honored and excited to be a part of. So we're really focusing on tethered oral tissues tonight, which is a big part of airway dentistry, and sometimes a missing piece in some of the practices, in honestly in airway practices and in really orthodontic practices. So tethered oral tissues is really focusing on muscle function, particularly tongue function is a huge one, and comes in all shapes and sizes. So not all tongue tie looks the same, not all buccal tie looks the same, not all lip tie looks the same, and they don't all have the same impacts on growth and development and function and breathing. So we have to look at them all individually and see, what kind of restrictions they present with. Why does it matter? Untreated tethered oral tissues can impair proper nasal breathing, can lead to poor sleep and disrupted craniofacial growth. Why is that? Because our tongue is our natural expander. It is our natural guidance of growth, particularly of the maxilla. It also impacts how easily we can breathe through our nose. So if our tongue is sitting low and we have poor tongue posture, we create more resistance in the nasal passages. And so that leads to more mouth breathing and less nasal breathing. Nasal breathing is the optimal way to breathe. It is the optimal way to oxygenate our body with clean air, decreasing things like inflammation of tonsils and adenoids. Nasal breathing also helps us get into deeper sleep. So having a tongue that is working well really promotes all those airway goals that we're trying to reach with our airway interventions. So untreated tethered oral tissues can actually work against us in our other airway treatment modalities if they are not screened for and addressed. Early and accurate diagnosis is really, really important. Thoughtful treatment improves airway feeding, speech, and long-term health. So it's not just about releasing the tie, but it's about how we approach the release, how we approach the treatment, usually in an interdisciplinary fashion. And the earlier we can identify and diagnose a tethered oral tissue, the more benefit we get out of it. With that said, it is never too late to treat tethered tissues. So I treat in my own practice birth through adults. It is the only adult treatment I do in my practice. But it is because we can get benefit at any stage. We just need to know how to approach the treatment so that we make sure it benefits the patient and doesn't create more issues down the line. So, what are some potential impacts of early oral dysfunction? So, it can affect many things, and it doesn't always affect all of these things. And the reason why is the body is very smart. It will try to compensate um, for its deficits. And a lot of times, these symptoms are masked. So, when we are approaching someone with a tethered oral tissue, they may not check off all of these boxes, but we may pick up some of the signs of oral dysfunction created from a tethered oral tissue that is left untreated. The earliest sign is during infancy. And this is a huge part of my practice. And probably in the general population and healthcare in general, the most commonly known impact of a tethered oral tissue is on the infant's feeding side. So, poor latch, pain while feeding, gassiness and reflux, poor weight gain are some of the major red flags we see in the infant feeding population. And one of the things that brings parents in most in the infant population. Then, when we graduate to solid food eating, so 6 months, a year, early toddler phase, an untreated tethered oral tissue can create difficulty with textured foods, spitting out food, pouching, picky eating. So in our practice, we don't just ask, is your child a picky eater? Because we have somewhat normalized, oh, they're just a normal toddler picky eater. That's not a thing. That's a thing that we have created because a lot of our toddlers don't know how to chew and swallow well. So we ask, can your child eat meat that's not in a hot dog shredded ground nugget form? Because all of those things are essentially pre-chewed for them. So, that is another, development milestone is the solid food eating. So if we missed it during infancy, how are they doing with their solid foods? Speech, articulation difficulty, or speech delay. Speech delay is an earlier sign. So when we are a young toddler, we're not hitting our number of words that's considered normal for their age, or they're trying to say a whole bunch of things that make no sense. A big red flag is a parent translator. So parents will start to automatically do this. A toddler will try to say something, and the parent will automatically translate it for you. Well, that's a red flag. As kids get older, 4, 5, 6, 7, if they cannot say their consonants well, that can be impacted by a tethered oral tongue that is not moving well, because we need that tongue to be able to contact the palate to be able to say certain sounds. And then for all the airway people out there, a tongue not working well can definitely impact our respiration and sleep quality. A tongue sitting low will be more prone to mouth breathing, which is the start of sleep disordered breathing, which, if it goes on long enough, can create sleep apnea. The tongue is our growth guidance, like I mentioned. So we'll see an underdeveloped maxilla because that tongue has not been elevated and pushing on those palatal bones, leading to the next group of symptoms, which is development of the airway and the oral cavity and dental health. So crowding. And we see crowding with underdevelopment of the maxilla. If there is a lip tie, then a diastema between the front teeth. Also, we can see an increase in cavities, and that is from our mouth breathing, but also from the fact that our tongue is our tooth cleaner. So if it is not moving well, then things are sitting in our teeth longer. And then grinding, which is related to airway and underdevelopment of the upper and lower jaw. And lastly, the tongue is part of a whole body fascial system. So it's not just dysfunction here, it leads to dysfunction in the entire body. On infants, the most common thing we see is torticollis or favoring of one side. and plagiocephaly, which is the flat head, kids that need to wear those helmets. But eventually, it leads to poor posture, headaches, chronic neck and back tension. So when we treat these tethered oral tissues, we're not just treating oral dysfunction, we are treating body dysfunction. And this is also why we need to work on interdisciplinary teams because it's not just about the mouth. I love this photo. This shows what craniofacial growth looks like when it's normal and also the timeline. So a big thing here is looking at how early this development happens. So by 2 years old, 50% of that development has happened. So if we're sitting on a tongue that's not functioning well because of a tether, then we are missing out on a huge growth and development period of these toddlers' lives. So I know in my community, there are lots of practitioners that treat infant ties, but then once the infant gets older, 10 months, 11 months, young toddler, they just want to wait until they're about 4 years old to treat that tie. Well, now we're missing years of that tongue guiding our growth and helping develop that maxilla and good nasal breathing. And now we're just behind the eight ball. So now we've complicated this treatment so much more. Now we have to put an expander in and then still treat the tongue tie. So this early diagnosis, super, super important. And this is also why airway treatment young on the expansion side is also really important because we can capitalize on a growth curve rather than trying to make a body move later that doesn't want to naturally move. So this is where the nasal breathing early, the tongue up posture early, the proper chewing and swallow pattern early is really, really important. So key pillars for profitability and ethical integration. So now you know briefly why all of this is important. So how do we get this into our practice to make it work? Well, there's 5 different things I'm going to go over. Again, not super deep dive tonight, but just to give you an idea. And the first one, the 5 are methodical clinical foundation. So as practitioners, you have to be well trained. Clear treatment decision pathways so you get predictable outcomes, investing in the right tool, training and empowering your team. You cannot do this solo, I'll tell you that. And then mental preparedness as the clinician. So if you've done anything in medicine, you know that there are going to be peaks and valleys, and you have to be able to ride those waves. So starting out with the methodical clinical foundation. So you want to look at function, airway, interferences, so things that we've already compensated for, what the range of motion is, extraoral tissues, so you can't just look at the tongue, and symptomatology. So you have to look at the big picture. And even if you're not planning to treat the tethered oral tissues, you have to at least know how to screen for them. Because if you leave them untreated and you're doing other airway interventions, those are only going to be so successful if you leave muscle dysfunction behind. And vice versa. If you are treating tethered oral tissues and you don't do other airway interventions like expanders, you need to be able to assess airway space before you treat these ties. So you have to really look at big picture function. And these things this knowledge comes from not just one course. It comes from taking multiple courses and also doing cases and learning from your cases and shadowing other practitioners, not just in the dental space, but in the functional space. So I have spent a lot of time with speech language pathologists and chiropractors and myofunctional therapists and lactation consultants. The more you know about the way the body works from a functional perspective, the better you're going to be able to assess your patients. So yes, it's about taking the courses and reading the books, but it's also about looking at the practical implication and watching other practitioners make the body system optimized. So you have to have a good foundation because it will also give you confidence in the treatment that you're doing. So when you hit a bump in the road, you don't, get scared and run in the other direction. You just take a step back and reevaluate because you have a good foundation to stand on. Clear treatment decision-making pathway. This is huge. This is where the function first model came from. And when I started this, my treatment approach did not look like this. It looked very linear. It looked very procedural. I see a tether, I release a tether, and now things are supposed to function. That is not predictable, and it is not how the body works. Working on a human body is a very humbling experience because you can have a lot of knowledge, but you're working with a human system. So every single one is different. The reason we use the function first model is it not only looks at the actual physical barrier, like the tether, but we are partnering with other providers to really look at full body system and prep the entire body for the change that's coming with a procedure. The other reason we use a function first model is you will see as you treat these patients, you're not just treating a singular patient, you are treating an entire family. So, especially in pediatrics, if a child is not sleeping well, well, guess what? The parents are not sleeping well either. So everyone needs some support from you, even though your patient is the child. So the function first model, the first thing we do is talk to the family. We see where they're coming from, what their struggles are, what kind of support they need. We also talk to partnering providers. So in pediatrics, that is mainly pediatricians. And as many of us know, if you're in this field, not all pediatricians are aware of what we do and the benefits of it. And some of them are just outright not on board with it. But the best way to get them on board is to try to educate them and partner with them. So they're always part of our conversation. Functional providers are the biggest key in this model. And depending on the dysfunction that we're seeing, that may be one or multiple people. And that may be myos, chiros, PTs, IBCLCs, SLPs, and beyond. So it's really about incorporating a team. And then lastly, the release provider, which is generally the dental professionals that are actually performing the release. So it's really about incorporating the big picture, and it's a process. It's not a quick fix. So when we use this model, what it leads to is predictable results. It also allows us to discern whether a procedure is actually indicated or not. So we don't want to be over treating, but we also don't want to miss cases that we otherwise would miss if we were just looking at the anatomy of these ties and not looking at the functionality. So that's really what the gist of the function first model is, and we use it in everything in our practice. And then investing in the right tool. So some of this is going to depend on what patient population you're working on. I have personally used all of these tools. Some of you may already have some of these tools in your office and may want to use these. So I'm going to briefly go over each of these things, some pros and cons. Currently, I use a light scalpel laser because it works best in my hands and in my practice. It is certainly not the only tool you can use. So starting out with our scissor or scalpel tools, pros are very financially friendly. There's no heat introduced in a scissor release. The downside of a scissor release is if you're working on a patient that's moving, it is not a good idea because the depth of cut is not very well controlled. So it really depends on, again, what type of patient you're working on. Also, bleeding control with a scalpel or scissor is more difficult than if you're using laser technology. Moving on, we have the diode laser. Good thing about the diode laser is that if you have a bleeding issue, it does cauterize. And it can be used for other things in dentistry. So if you are a general dentist that's doing perio things and scaling and root planing, your hygienist can be using this diode. So it can be used for other things. Downside is the heat. It can cause a lot of inflammation post-procedure, and it does frenectomies pretty slowly. So if you're using this, you really need to be on top of post-op care and post-op discomfort. In my opinion, not great for this type of procedure because of the inflammation and heat that it causes, which will increase scarring during healing as well. Next is a BioLase erbium water laser. And this is actually the tool that I started my practice with. because I was going to use it on hard tissue as well, which I didn't end up doing because it didn't work well for me. So I did a lot of frenectomies with it. But once I saw the comparison to the CO2, I sold my erbium laser. So again, the erbium is great if you're going to use it for hard tissue because you can also use it for that. It's not just for soft tissue procedures. Not as clean of a release as the CO2 laser. The CO2 laser that I use is a light scalpel. There are CO2 lasers that are hard tissue as well. So if you're wanting to do both, then there are other options. In my opinion, it gives me the cleanest release. Healing is beautiful. There's not a lot of inflammation because it's really not that heat based like the diode is. And it is very precise. So I feel very comfortable doing it on a moving, awake patient. I do a lot of toddlers awake, no sedation. And honestly, it's harder for me to get a photo of the release than it is to do the actual release. So that's just a brief overview of the different tools. The light scalpel obviously is not a hard tissue tool, so that is the downside of it. But if you're doing this type of procedure, I mean, I have two offices and I bought two of them, even though this thing travels well, because it is that valuable in my practice. And then training and empowering your team. So this is really, really important and takes a lot of effort and time, but you will limit your growth if you do not lean on your team. So you really have to invest in their training. And I will tell you, no assistant or front desk person or phone person started my practice knowing anything about airway and tongue ties. The best thing you can do to empower them is give them knowledge, but also treat them and their families. Because once they see the value that is brought to their family, they will be your number one advocates. I mean, now I walk into a room and they've already explained everything because they've lived through it. And I treat them for free. It is an investment in them, but it's also an investment in my practice. So you really have to spend the time training them well because they are representing you. And so if they are not trained well, then they are, you may not even end up seeing that patient if your phone person does not sound like they know what they're talking about. So admin team, lots of scripting. We have everything scripted. They all, during their training, spend a whole day shadowing the clinical side as well, so that they can talk about what that aspect looks like. And scripting doesn't mean robotic reading off of a paper, but initially when they're starting, that is what they do. And then they add their own spin to it. And if you treat them personally, then they will add in their personal side to it. And then it becomes more of a conversation with that patient. Scheduling. So teaching them how to schedule these things. I personally still do dentistry. So on my days, I am doing all the things. I'm going from a recall to a tongue tie consult to a ortho adjustment. But that, so they have to know how long you spend in a consult, like so that they can make sure that you're staying on time, but also being efficient. Coordinating. So this is where, because we use the function first model, timing of the procedure. So have they finished all their pre-myo appointments or their chiro appointments? So in our office, we have a therapy coordinator and she calls to get clearances for procedures. So she is calling the chiro and the lactation, making sure that they are ready for their procedure because that's how we get predictable outcomes by the patient being ready. And also making sure that they have follow-up appointments scheduled with their therapist because that's how we get good healing. So it doesn't just stop with the procedure, but we have to help support these patients and guide them through coordinating all these appointments because it is a lot, And then having some compassion. We are asking a lot of these patients, but we also have a standard that we have to live up to. So yes, we are not just going to release your tongue tie. We're gonna require that you do pre and post therapy, but we're going to help you through it. And we're going to be here to support you and give you education and try to make this as seamless as possible so that it doesn't feel overwhelming. Initially, I was doing a lot of that, but ultimately I cannot do all of that. So you have to empower your team to have the knowledge to do that as well. So Some things that help us, these are intake forms that we use for phone calls. So we try to list out all the questions that need to be asked, and then also prompting them because, introducing the idea that the dentist is asking you to see a chiropractor is new for a lot of people. So asking them why, like telling them why these things are important, but asking who they're seeing so we can start that coordination process. We also have emails of referrals of a list of providers that if they're not seeing someone, hey, if you're waiting to see Dr. Gandhi, here's a list of providers you can get started on this pre-work, so we're not wasting time. On the airway side, similarly, do they need a Thai consult or an airway consult? And I know this writing is pretty small, but basically we start with some screening questions and then that directs our phone person. Well, this is the type of consultation you need and this is why. And they literally can read it off this form if they need to. That way we're scheduling appropriately, but we're also giving our team the tools to have the talking points to tell the patient why we're scheduling this type of appointment. We use Open Dental. This is a sample of one of my schedules, and you can see that we're doing things simultaneously. So we're running about 4 chairs at the same time. You don't have to do this way. You could do a model that looks like this, where you have your frenectomy days, and there are pros and cons to each of these. In this situation, you have to be able to pivot in your mind one type of appointment to another. And this allows the most flexibility for my front office. It also allows me to see all types of patients on every day that I'm in office. If I do this type of thing and I do frenectomies 1 day a week, if someone calls on a Thursday and my frenectomy day was on a Wednesday, well, now they're waiting a whole week to see me. And if it's a baby, they may not want to wait that long for a consultation because a lot of these parents want answers right away. So these are things to think about and things we're going to go through even deeper on the deep dive course about pros and cons of different types of scheduling. The clinical team, similarly, we have to train and empower them to assist for these procedures, know how to take the notes, teaching aftercare, so the stretching routine. I used to teach this all myself, but again, at some point you're going to run out of time. There's one of you, and there's your team that you have to give them the tools to help you because they will also own more of that then. And then providing hands-on support. So we make everything digital through Open Dental. This is now my assessment form. It is clicking of buttons and a quick email to the patient. So we started with paper, we started with 3 different forms, and now we've kind of pared it down so that it's nice and concise. I spend about 9 minutes in a consultation now if it's just a Thai consult. Setups, so taking pictures of everything during your training. And then this is for our older kiddo forms, and this is our frenuloplasty setup. So again, our training manual has pictures of everything, and if they forget, there's a quick reference in our sterilization. And then lastly, clinical competence, and resiliency. So as a clinician, if you are in the airway space already, you know that this is not uniform treatment in the dental field, in the medical field. So we are still fighting some of the battles of why we do this treatment, and it's not always going to be smooth. You may have people that question why you do these things. You may have some reviews that come in, a lot of positive ones, but the negative ones are the ones that we kind of spin in our head over and over. And you're going to have to be able to jump back into things and to really believe in this type of treatment. You cannot do this unless you really believe in the benefit, the medical benefit of it, because you're going to hit challenges. And some of those will be clinical challenges where the procedure doesn't go right or you have poor healing. And other of them are going to be more emotional challenges where you have other healthcare providers telling you that you should not be doing this type of thing. But if you have taken the training and you have seen the benefit and you know that you're making the right decisions, you'll carry on and you'll overcome. But that doesn't just mean clinical, competence and taking care of yourself in the practice. It means taking care of yourself outside of your practice. So doing things for your own mental health And having a balance is really important. So that when you hit those challenging times, you can pat yourself on the back and say, I'm going to learn from this and move on. So those are the 5 things that we are going to look into much further, really in the second part of our mini residency. But this just gives you an idea of when you start these things, it's not just about learning a clinical procedure that can benefit your patients. It's about really knowing the steps to take to incorporate this from a business standpoint, from the billing to the training to the flow, so that you can actually make this profitable to your existing patients. You don't need to find new patients. They're all sitting in your chair. So it's not about patient recruitment. It's about putting systems in place to make this successful. So bottom line is a tongue tie program only becomes truly profitable, predictable, and impactful when you do it methodically. I'm a systems person. That's kind of my forte. And so that is really on day 2 of this mini residency. What we're going to look at is a lot of systems to implement. And so a structured approach isn't just operational, it's truly transformational. So, if you'd like to connect with me, these are the ways you can connect, or you can reach out through Airway Health Solutions. I love to talk about this stuff and support practitioners. And we'd love to see you in the new year at the 2-day course. But again, thank you so much for attending. I know it's probably after work for a lot of you. So really appreciate your time and attention.
Thank you so much. And it is so helpful, and it can be a little overwhelming, to start something
Yeah.
new. And I saw your Instagram pop up of just, we didn't learn this in dental school, and it's one thing to do it. And I'm just so grateful that you've taken the next steps to teach it. So thank you for being a pioneer in the space, and everyone can benefit from your practical way of delivering and your passionate way of patient care, comprehensive patient care. So again, we're thrilled to have you. We do have some questions as well.
Absolutely.
We will put in the link if you want to learn more about Dr. Gandhi's mini residency in January. We'll put that in the link, and then we'll review it in a little bit more detail after the Q&A, just so we make sure we have everyone's questions answered. How do you explain that patient has tongue tied, but breastfeeding is okay? Lactation did not say anything. I'm trying to interpret.
So yeah, great question.
Okay.
Breastfeeding, and this is where when you learn more about lactation and the process of breastfeeding is really helpful. So breastfeeding is a 2-man job. And so some mothers will have a great milk supply, and they'll essentially compensate for a baby's lack of tongue movement. So they don't have to work very hard to actually gain weight and feed. There are other ways that parents compensate that they don't even realize. For example, frequent feeding. So if a baby cannot get the milk after what's called a letdown, which is when the milk naturally comes out, then they'll have short feeds, but they'll be hungry every hour to hour and a half, and the mom just thinks, oh, they just want to feed more frequently, so they'll just feed them on demand. And what they're really doing is compensating for the fact that the baby is only getting that initial letdown milk and not more. From the lactation side, there's different levels of lactation providers. IBCLCs, which is International Board Certified Lactation Consultants, are really who we try to look for and refer our patients to, because they are the only ones that get some tongue tie training. And even then, it's like us as dentists, they really don't get enough. So it's the ones that, similar to myself, like struggled with their own child and then really took a deep dive. So you're not going to get uniform lactation providers knowing about these things. And so you have to explain that to parents, is just like, just because they're breastfeeding well doesn't necessarily mean that the tongue is actually doing what it's supposed to.
Great answer and great question. What payment system is integrated with Open Dental and scheduling? If you don't mind, just quick.
Yeah, so we use something called BC Pay, but there's global payment. There's several. They have lots of different payment options that directly integrate into Open Dental. And they can even pay over the phone or scan a code. It's pretty user friendly.
Great. And The link for the 2-day course is in the chat. You can copy and paste it, but it's airwayhealthsolutions.com/Gandhi. And we do have an intro price of $500 off, so you want to take advantage of that. Just so you know the format of it, we're doing this virtually live, and if you can't attend one or both days, there will be the recording, and you will have 30-day access to the recording. But the first one, we always love to do live to get the live Q&A, to make sure that we have the feel of everyone's questions, so everyone can benefit from that live type of simulation, if you would. Someone just said, awesome presentation, so thank you for commenting on that. Do you bill out of network?
Yes. So my entire practice is out of network. And we will go through like detailed billing in the 2-day course, like codes to use, narratives, because you will experience kickback from insurance. And I'm sure all of you experience this in dentistry, but they will also, try sneaky ways to make things more difficult as you start doing more of this. So we have like stock narratives and we've figured out, the buzzwords that they want to hear in the claim, just to try to streamline. And we know there are certain insurances that will not pay or give us a hard time. So now with those insurances, we have been collecting up front for that. So you'll figure out like the nuances and things like that. But we are out of network as a practice as a whole. And I would say if you're going to incorporate this into your practice, I do advise sticking to whatever payment model you have as a practice as a whole. It gets very tricky if you start to do a sub practice within a practice for this type of treatment. But that's something to think about in terms of reimbursement if you're in network, if you're in a network provider. But this is also where if you're getting lower reimbursement, really training up your team so that you're not spending that much time in that room is really important for profitability.
Great. And I know we have, I think another question here is, do you consider all maxillary central incisor diastemas indicators of problematic breathing indicators? We'll start with that.
No,
Okay.
I don't.
Follow-up. Have you ever seen a child or adult with such diastema and no indication of any observable problems?
Yeah, so in my opinion, the maxillary labial frenum is not the major culprit of airway issues. It's really the tongue that plays a bigger role. Where the maxillary labial frenum comes in is lip competence. So we do want to look at that. And from a speech perspective, bilabial sounds. But, I get this question of like, if we release the maxillary labial frenum, will the diastema automatically close? Not necessarily. And I mean, I'm in the business of creating diastemas because I want spacing between teeth. So I don't have a problem with the diastema. It's just can be an indicator of the tension that can be created from a lip tie. And really what you want to look at is functionality. So how is that lip moving? Not so much like only where is it inserting. That's part of it, but not, again, we got to look at function. And, again, we're going to talk about how to diagnose. It's like a 3-part thing when you're really doing a comprehensive diagnosis.
Okay, great. And where are you located? Do you say you treat toddlers without anesthesia, age 2 to 4? Sometimes older is typically a time avoided for local providers without anesthesia.
Yeah, I'm in Houston, Texas. And yes, I treat all ages, and I do utilize nitrous and sedation in the office if it's needed. But for a lot of the 12 to 20-month-olds, I'll do like in a big kid swaddle, awake as long as the parents are okay with that situation. So it's a conversation with the parent, but we get a lot of patients that don't want to be sedated. So we try to accommodate that. And I feel like I can only do that because of the tool that I use and because of the team that I have, that they're comfortable treating kids like this.
Okay. What are the most prominent issues you've seen with adult patients? But you're a pediatric dentist, so.
Yeah. So One of the reasons why I'm comfortable in the adult arena is I was a general dentist for 6 years before I went back to residency. And I did not anticipate getting into adult airway and tongue tie treatment. It just was a result of the parents of the kids that I was seeing. Um, Major things, I mean, they're mainly airway and tension related. And all the adults that I treat prior to, they get a CBCT because you want to make sure that their airway is healthy enough for a tongue tie release. Because if you release a tongue tie into a small posterior airway space, you can actually close off the airway more and make sleep worse. So I don't do adult expansion or MARPs or anything like that. So if we do a CT and yes, maybe they have a tongue tie, but they need airway growth, then I'm sending them out to either the oral surgeon or the perio who's doing those things. And then they're coming back to me for tongue tie release. But if they have a healthy airway, then we can do the release. And a lot of them, it's TM joint tension, neck tension, postural tension, and sleep concerns. So that's when we see the years of compensation catch up, a lot of TM joint issues.
Do you numb for the frenectomies?
Yes. The infants and the infants topical, the toddlers compounded topical, and then beyond that, it's local as well.
Okay, great. Well, let me see if there's any other questions that we can, let's see. I think we are good. This is really informative, and I love that we touched upon the business side because it's really important. And as I said, to integrate it, and we're thrilled that again you're on faculty. I love working with you, just going through this kind of like as a cookbook to integrate this into your practice. So we are offering $500 off of our $2,499 price. So the price is $1,999 for the 2 days, and it's virtually live. And again, if you can't attend one of the dates, it will be recorded and you will be able to view it on your own with 30 days access to the course. Why don't you tell us a little bit, Dr. Gandhi, about the format of the course? I know you're really excited about it with day 1 and day 2 as an overview.
Yeah, so day 1 is really more focused on the clinical side, kind of really getting a good foundation as to why this treatment is important, how you can, screen your patients, the treatment approach, which is a really big deal, and the really working on a multidisciplinary team. And that doesn't necessarily need to be people in your office, but in your community. So we go through why each of these types of providers is important and how they play a role. We'll go through many cases of all different kind of pediatric ages. So you kind of see how these things work on real patients. And day 2 is really focused more on the business side. So whether you're getting started, meaning you don't have any of this in place, or even if you're doing like a startup practice, to all the way if you've done some of these, but you need more systems, you need to streamline. How do you train more of your team? How do you get better, return from your billing? And then also like marketing things. How do you market yourself? How do you talk to existing patients that are already in your practice now that you're introducing maybe this new type of treatment? So really working on the day after the course, what is the thing I can implement in my practice to make this feasible and profitable? So it's kind of like the clinical foundation and then the business side of it, day 2.
Right. Well, it's going to be comprehensive, and I'm so excited, especially for those offices that don't have people to refer to. We hear this all the time where they have to travel, 4, 5, 6, or take a flight. So the more airway dentists that can incorporate this into their practice, especially when they don't have referrals, the more children that can get that comprehensive care. So again, thank you for sharing your knowledge and being your due diligence to make sure that you are able to integrate this into the practices. We do have our holiday special at 20% off of all the courses. I'm going to go over a lot of upcoming courses. We're really excited with new faculty on board. We do have, we're going to go in order here. So January is Dr. Gandhi's new courses, but we have Again, Dr. Mariam Matlas, she's going to be doing her course the end of February. This is for the adults. It's reconstructive dentistry and airway health, utilizing the myoliner, which is an FDA-approved solution. So we will have more information on that, and I'm sure we'll have another webinar to bring everyone up to speed on that. We do have a pediatric airway health with Dr. Umakant Katwa and Dr. Stanley Liu. So save the date. That's March 13th. That's a one-day course. Again, it'll be live virtual. So we're really excited because this is going to be a tremendous tool to share with your pediatric community, excuse me, your medical community. You can bring them on board, have lunch and learns, be really well educated and well versed on that collaboration. And we're actually excited that we may have pediatricians attending this course. So we're trying to smooth the road for you so you can then go in and just kind of reinforce the collaboration. So that's our goal. We're also excited for this 2-day mini residency with Dr. Jenna Schwibner. That's going to be an integration airway health course. And we're going to have it live virtual again, April 10th and April 24th. And shadowing will be available for all of our faculty as well in the dental space. So stay tuned for more. I'm sure we'll have another webinar on that. And we do have a course that launched already. It got really great reviews, and you can integrate soft tissue laser therapy for adult airway and sleep health. This is a 3-hour course. You will learn a new skill of how to do soft tissue laser treatments for your adults, especially the ones that don't want to move forward with expansion per se. They just want to maybe just do something. This is a great way to get them rolling in the right direction. So check out Dr. Cohen's course on our website. And, you know, we're constantly trying to provide solutions for everyone. So Dr. Cohen and I were actually on the phone a couple of weeks ago, and we thought it was a great idea just to have a photography course, because this is really so important for co-diagnosing and sharing. Instead of show and telling, you really show and sharing their photos, and the photos matter. So we thought that this would be a great course, an adjunct course for all of our courses, just dentistry in general. So stay tuned for that. We just put that in the works last week, so we're excited for that. And then Dr. Cohen will also have a metabolic and circadian health mini residency coming in April. So 2026 is going to be really exciting. And we always have our mini residencies going on with Dr. Ben Moralia, and it's really the foundation courses. So that gets you into our alumni, that gets you on our airway dentist locator. And that's what Dr. Gandhi has taken these courses as well. It's part of the portfolio. We recommend taking everybody's courses because you can't learn too much, but we think that this is a great way to get started and look at the website for wherever you're at. If you're new to airway dentistry, you may want to start with the fundamentals course. And if you have some knowledge and want to start integrating this to help children in your area, then we highly recommend the pediatric mini residency. And the adult mini residency will do removable expansion, which is an option for patients. You know, maybe they don't want to do MARPE, and then also the clear aligner therapy. So I'm always available if you want to talk with me about a journey that's suitable for you, where you are. Just start where you are and let us help you along your path. Dr. Boyd's advanced mini residency is really treating below 6, so fixed below 6, and it's ages 2 to 6. So that's more of an advanced course where Dr. Ben Moralia's pediatric mini residency is strongly recommended. We want to make it a prerequisite, but it's strongly recommended. So it's something you may want to consider. And then for our adult patients who suffer from acute TMD, Dr. Gelb has a solution with his mini residency. It's basically the prequel to expansive orthodontic treatment. I love all these new faculties because it's really exciting to get this whole portfolio where we have you covered. But Dr. Dave McCarty is an MD, and he has a sleep apnea and screening course, and he really takes the complexity of sleep apnea and breaks it down so you can have these conversations with medical providers, with your patients, and really understand what your patients are going through who experience sleep apnea, and just are able to have those thoughtful chairside conversations. Dr. Susan Maples has a wonderful course, Looking Beyond the Mouth, Becoming Wildly Successful in the Practice of Pediatric Airways. And this is a great team course as well. So again, you're going to learn from everybody. So I think 2026 is a great year to kind of fill out your portfolio. Myo is a huge portion of this portfolio, right? I know Dr. Gandhi, we really can't do it without Myo. So if you don't have a myofunctional therapist near you, we do offer telehealth myofunctional therapy through Airway Health Solutions, but we always love to get that in-person care when possible. So you can have your dental hygienist learn, a speech language pathologist can learn as well, or you can take the course yourself. And it's just great to learn about it. I took the course myself just to learn more about it and didn't integrate it, but our next course starts January 28th. And now we offer study clubs for our existing alumni. You may not have known this, but we do offer study clubs for the courses you've taken. So give us an email to all our alumni out there. You do get CE for the courses, so it's ongoing continuing education, and you can have a case review as we do with the Q&As after the mini residency. So a lot of people are jumping board and taking advantage of that extra learning, extra handholding, and extra community. Our next upcoming AHS is our Q&A session. It's December 17th. We're having we always do a Myo Q&A. So anything Myo, any questions you have, if you're curious about it, if you want to ask Brittany any question, this is a great time to do that. So we're going to have a lunch and learn, and that'll be December 17th. So we will send all this information out to you. It is a lot. But Dr. Gandhi, we're excited to see you and Dr. Cohen and Dr. Schwibner and Dr. Moralia and Dr. Christensen, all our faculty at the Breathe and Thrive Symposium 2026. I hear it's almost sold out, so that's really exciting. That's in Summerlin, Las Vegas. So we're going to do a little West Coast action. So hopefully we can see you all there to get together. And I always also want to plan ahead is that we will be April 23rd, 25th at the 22nd annual SEC Sleep Conference that's run by Dr. Gerald Simmons, and you can see the lineup he has as well. So the learning never ends, and I love it when people come together because you will never learn the same thing, and there's pearls for everybody. So really excited about what's to come 2026. And again, Piya, thank you so much for your time.
Thanks for having
me. And now let's give away our free raffle for the foundations course. So let's take a look and see. Got to be in it to win it. So let's see who's here this evening. Okay, Megan Uditani. Welcome. We have a winner. So we will reach out to you. And Dr. Gandhi, why don't you close this out? Because you know, this is everyone's so curious about this topic, and some people know more than others, and there's a little bit of probably hesitation, I would imagine. But from your experience, you started where someone was sitting this evening, just curious about it. Why don't you give like a little vote of confidence of why they may want to pursue?
Yeah, I mean, I would say like it definitely can be intimidating seeing people that lecture that all the things they're doing, but it honestly is one step at a time. It's one course at a time, one patient at a time. Like I said, when I started my practice, I was not anticipating doing any of this. And I will tell you, my first release definitely doesn't look like the releases I do today. And courses are very important. You should definitely get the education, but the way you're going to learn is also by doing. So you have to start somewhere and you know, be realistic about your expectations, but know that once you start, it's like anything else in dentistry. Once you start seeing the value to your patient, but also to your practice, it's just a matter of time. And I will say, like, the thing that I hear most is that it's scary because I didn't learn it in school. But you're going to learn all you need to know through these courses. And just like everything else in school, it's just you got to practice it. And so I would just encourage you to start the process. You don't need to know what the end looks like to take the first step. So we are all tend to be overthinkers. Just take the first step, and then the rest will naturally come as you go.
Absolutely.
That
And as
would
far
be,
as the time goes, basically the first day is a full day.
yeah,
Believe it's going to be 9 to 4. And then the second day, I think we're doing like a 9 to 1, if I recall. Right.
yeah.
So it's proximate because it's the first one. So that's the approximate time. So we'll update the website. And this is a good question, Dr. Gandhi, just to clear up. Do you teach the actual procedure during the course? Can you talk a little bit about what it is and what it isn't?
Yeah, so I do go through some procedural technique and show a lot of videos that I'll talk through the technique. What I don't do is take a deep dive into anatomy. So, if you're looking for like you want to understand every muscle and everything in the tongue, then honestly, I this course is not that course. So you will learn some of the technique and the technique that I use, but you're not going to learn the foundation of the anatomy and physiology behind it during the course. Um, Dr. Zaghi teaches a good course on that.
Exactly. The Breathe Institute
Yes,
recommend that, and also
yes.
Dr.
I would recommend
Bachelor's
their course.
course. Yeah.
Yes,
So usually,
either their
this
course.
isn't like a fundamental tongue tie
Right,
release course. This is kind of
right.
a next step and add on and adjunct for those who
Yes,
are already trained in tongue tie releases. So I just want to
yes.
be
And I
clear
will
on that.
give a list of recommended courses for for those types of,
Mhm.
educational opportunities. But yes, this is not that course where you're going to get the fundamentals.
Okay. All right. Well, I appreciate everyone so much for being here. Again, it's the busy holiday season, and thank you guys all for warming my hearts this holiday season, just for this community that we've built and just really the passion. And thank you, Dr. Gandhi, for all you do. And we're so
Thank you.
thrilled to have you. You're such a great asset, and you're going to help so many. So thanks again. Happy holidays, everyone. And we will be back with a full schedule 2026. More conversations coming, plenty of courses, and we'll keep you all informed. We already have your email, so stay tuned for our newsletters and updates, and we'll see you in the new year. Thanks again,
Thank you.
everyone. Have a good night.